So how are the government going to deal with the ageing population and adapt policies to work with the changes in the industry? John Rouse, newly appointed Director General for Social Care, has been charged with coming up with the plan. Lloyd Bracey went to meet him.
We know that the UK population is getting older. There have been a lot of recent stories saying that the infrastructure can't cope with all that. What's the plan?
Well, you're right in saying that demand is rising and we have got an ageing population. The number of 85-year-olds and over is going to double over the next 10-15 years. And so there will be pressures on the system. And what we have to do as a country is prepare for those pressures. And there are several elements to that. One is about money in the system now. And through this spending review period, the Department and Government has put in an additional £7.2 billion into social care, some of that money into the local government funding pot and some of it through the National Health Service. The second is actually giving people certainty about what they will need to fund in the future. And that is why the Andrew Dilnot report was so important, which the government responded to in the last few weeks, so that by April 2016 there'll be a new system whereby people will know what the caps, what the mean testing rules are in terms of what they are going to have to contribute to their care. And then the third part is actually about the market itself and making sure that we have a good range of quality settings, both in domiciliary care and residential care, that people can have confidence in terms of their old age.
What about primary care? I was just looking at the options. You've mentioned some of them. You didn't mention that one.
Primary care is crucially important and the role of general practitioners within the system. In many ways, we'll be organising a lot of our care around those practices going forward because it's the GPs who will have the opportunity to do early diagnosis, for example, in terms of dementia. Their prescribing policies are going to be really important. I think increasingly we will see a lot of assessment of need and care planning being done jointly by general practitioners and social workers around clusters of GP practices.
Hospitals, because they have been asked to bear a lot of burden, are bearing a lot and will clearly, from what you say, have to bear a lot more. What part do they play?
Well, they've got a huge part, but one of the lessons, I think, of the Francis review and what happened at Mid Staffordshire is making sure that as much as possible only those older people who need to be in hospital are actually in hospital for any length of time. And that means making sure that through use of telehealth and telecare and also just really high quality care at home and within residential care environment, that people are not going into hospital unnecessarily. And when they come out of hospital, in terms of discharge, that we put in place proper support from occupational therapists, physiotherapists, to enable them to stay at home or back in their residential care setting and live a full life as possible.
There's a saying, isn't there, that no plan survives contact with reality. You're a long-term planner. You've got to look at these things coming down the road. How confident can you be, hand on heart, that the proposals, the measures you're looking at are going to be adequate for the task?
I think one of the important things about the Care and Support Bill that we hope will be taken through Parliament subject to the Queen's speech in the next year or so is that it's a flexible framework. It establishes rights. So it establishes rights in terms of portability of assessments between different local authority areas. It will enable us in secondary legislation to set the threshold for eligibility for care and so on. But the important thing is that most of the definition of what is needed will be in secondary legislation and guidance. That means it can be changed and adjusted and adapted over time. Because you're right, we don't know for certain what we're going to require in 5, 7, 10 years. But if we've got the right legislative framework, then we can adjust and adapt to fit those needs as they develop over that time.
You're very new in the job. You've only just started, almost literally. When you look back on your 4-year tenure in office, what will you want to have achieved?
I think there are a number of things. First of all, I really want to deliver the care and support reform package. Some of that's in the bill, some of it's in the white paper. I'd like to make that a reality within the system. The second is that I would like to have contributed to shifting the dialogue about ageing. that ageing can actually be an incredibly positive time in life. You know, that second half of life and into retirement, it can be productive in so many ways in terms of making a contribution to society. And so I want to ensure that the debate about ageing is not about older people being a burden on the state, but rather about all the things that they can contribute within their communities.
Mr. Rouse, thank you very much for speaking to us. We look forward to coming back to speak to you next year to see how it's all working out.
Thank you very much.
Thank you.
Cheers.